And we'll come back from being recessed, but I'd like to start with the Pledge of Allegiance. And a moment of silence. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. So tonight is the third meeting of our budget review. Tuesday, February 25th, we'll start with item number 8, which is public participation. Anyone from the public wishing to speak to the budget at this time? Then we'll close public participation and move on to the New Milford Cemetery Association budget. Are they here? Well, that one will be a lot quicker than we thought. And so the next one up is item 10, and that would be the probate budget. Page, what do we have? Page 84. Good evening.
I'm sitting like right behind the Cemetery Association, yes.
Strategic planning.
I'm sorry, Marty.
That's quite right.
I didn't want that to read. I got the old view.
So, this is the budget that we're presenting. I've met with the mayor with regard to our budget. There's a slight increase. As you know, the consolidation took place in 2010. It's been going along very well. We did successfully bring all the court's records and materials into New Milford. Everything's been laser fiche, and we're right up to date. Actually, one of the projects was completed today. Any of the open files that were left over from a few other transitions, we just received some more confidential records. Those have been effectively laser fiche today. So we're right up to date from 1787 to the present day. This budget, I think, is more than adequate to meet the needs that we have going forward. As many of you know, it does encompass 5 towns, and there is an offset in that the revenue sources also include the towns of Bridgewater, Brookfield, Sherman, and Fairfield. So the costs that are shown here, the $17,000, there is some monies that come back to the town. New Milford's actual share is $8,851 with regard to our budget request on that aspect. And the other one is furniture and fixtures. Much like the mayor and these lovely chairs that we have, we do our best to try to get donations to the court with tables, with chairs, with anything that we can use to make the office that much more efficient and more professional looking. So, if there's any questions that you might have?
Thank you. Pete?
Thank you, Judge. Just a quick question, not an exact science, but how many would you say New Milford residents percentage would use the court versus the other towns as far as usage?
I would say that a distinct majority is from New Milford. Many of our conservatorships are from New Milford because we have the hospital and the nursing homes. So we have a lot of conservatorships. We have a lot of children's matters that originate in New Milford. The other towns, Brookfield does have a facility, but most of our work is from New Milford.
Thank you, Judge. Thank you, Nick.
Thank you. Beth?
I know this is the first year of the consolidation, really the full year. How's it gone?
Oh no, it's been going very well. It's actually, this is our 4th year, believe it or not.
I don't know how time goes.
It's gone incredibly fast. I think that as it's gone on, time-wise, it's gotten a lot more efficient. And I think that part of that is that we've been able to get into the other communities. We're having hearings there. We've always done hearings wherever they were required, or if it made it more convenient to the individual that had a need. So either a nursing home, a hospital, somebody's house, that's where we go to have the meeting or the hearing. So with the other communities, we've had more of a regular cycle into those communities. In Fairfield, we're there third Friday of some months. So each community, we make sure that we're there so that there are the resources that we have. And then also doing seminars, so they're fully aware through the senior centers and other, if there's something with schools, we would go and make a presentation so that they know what we can offer to them. And it makes it easier for people to understand that it's not really scary to go to court. And it makes it much smoother. Any issues that we might have, it has been very accommodating here in the building. If we need to have a larger hearing, we would have it up here or downstairs. If we require more security for certain issues, we're able to schedule hearings with the police department or working with the police department to schedule those hearings that we know might be contentious and require police presence. With the mayor's office, we're aware of the downtown officer, what hours they're really able to come into court. So it's actually something that's always in flux, but it's been very well received with the communities.
And then just to follow up on that, you kind of touched on it, but do you see any future needs as you grow and as this program becomes more popular? What do you think the future needs are 2, 3, 4, 5 years down the road?
Well, I think that we are seeing an increase in attendees at the hearings. And that really, unfortunately or fortunately, people are more interested in what might be going on, and that also sometimes brings more contention to a matter. So there might be a need for a larger space and conference rooms or private meeting rooms for different parties to meet, because sometimes it occurs in the hallway, which could get a little heated, and I don't think that that's really conducive to people coming in to visit the nice town hall that we do have, to have some argument going on right in the front hallway. So we really do try to know ahead of time when that might happen, and and it's something that's nice that we have with the mayor's office, that they might be where somebody's come to court a couple times or come to the town and said they've got an issue. So we're aware, but oftentimes these arguments we're not aware of until a person's been served and or received mail notice and they show up, and then we have a problem. But we're trying very hard to minimize that.
Well, thank you for your efforts.
Thank you. Katie?
Thank you for the presentation, Marie. I just want to make sure that I understand. So not only for the families that have certain issues, but if attorneys, often you have several attorneys, or at least two, they also need to meet in that rather public space, correct?
Right.
So that's kind of open to the world. It's either there or out in their car.
Right, and that's one of the things that is difficult to do, because many of the issues that we have that are boisterous, let's just say, if it's dealing with somebody's mental capacity or even the termination of parental rights, we don't really want that to be in the hallway. So oftentimes what happens is that I'll actually leave my office and let them use my office to get that done. Of course, it's not a perfect world, so when that does happen, oftentimes there's somebody else at the counter, which, any of you are welcome to come in. There's not a lot of counter space there. So if there's any person that has to go in or out of the office, it's very difficult to get that accomplished. So, we do have the vault. We have people sit in the vault sometimes and meet with their clients,
Yeah.
which, it's not one of my favorite places to sit, but, some people do sit in there and meet with their clients as to.
So there's an issue of confidentiality.
Sure,
as well.
there is a problem, right? And actually, years ago, one of the issues was addressed in that, if you're familiar with the office, there's a water cooler room right behind it. And when I first started in the office, that was a door that you could get in and out of. I guess the old judges, or the previous judges, I should say old judges, the prior judges had the ability to just go out the back door and not be there when something was happening that they didn't resolve. So I don't have that unless I jump out the window. But what happened was that on some of the confidential children's matters or other matters that we didn't really want people to hear, they would be able to stand outside in the water cooler room, and you could hear their footsteps, getting a drink or whatever the case might be. But with the mayor's help, that was actually sealed up and soundproofed. So, it's another meeting room, I guess, but it doesn't help us, right?
Good, thank you.
Sure.
Any other questions for the judge? Thanks, Marnie.
Thank you.
Thank you, Marty.
Okay, next up is the 119.
Good evening, all. Nice to see you again. I'm Bill Quinnell. I think I'm a permanent fixture on the Children's Center Board of Directors. And here tonight is Susan Johnson, our Executive Director, who I guess many of you know is the daughter of our founder, Barbara Kennel, and our controller, Linda Miss Kennedy. As you know, we're in our 43rd year of service to the families of the greater Milford area. In that time, we have had well over 3,000 children pass through our doors and countless hundreds of families. A significant number of those children come from economically challenged households. And because of our sliding fee scale, we are able to provide those households with an affordable child care facility. In many cases, that helps these families get their feet back on the ground, helps them remain in the workforce rather than opting for more dire social service requests. And the educational side of our program is really designed to help those children develop a sense of self-worth and curiosity about the world that we hope, with a little luck and hard work, will enable them to be successful in school and, frankly, have a better life than parents have. I know this because 36 years ago, I was one of those kids. And my now 40-year-old gainfully employed son is exactly one of those children. So if you have any questions, these are the people who actually make it work.
One quick comment that Bill didn't stress, which is really essential for the town council to understand, that nobody gets the sliding fee scale at the Children's Center unless they prove to us they work. They give us their tax returns, they give us their pay stubs, they give us letters from their employers. Now, that means our parents are a self-selecting group. These are not the people looking for handouts or entitlements. So last year I told you about the story of the woman that earned the lowest income in our school. She made $11,000 a year. She didn't own a car. She lived in the basement of her sister's apartment. She took the Hart bus. She paid us $8 a week. This year she's paying us $32 a week. She cleans houses, and she's very representative of the kind of families that you help. So thank you for the support all these years, because there is a hole in the child care services in New Milford, and the hole is that low-income group. They just don't have the support, the working low-income group. And you make it possible for them to pay taxes and to be contributing members of the community. It's invaluable. Thank you.
Mary Jane?
I just want to say thank you to you
Oh, thank you.
and your board. You do such a tremendous job and such a service to the community. It's very much appreciated. Thank you.
One of you last year suggested that we do an audit, an energy audit. I think it might have been you, Larry? Or was it was you?
Tom,
We just applied for a $750 rebate for our commercial dishwasher through that program.
We got a grant to get that dishwasher, because
Oh,
ours
yes.
died. And a water softener system, because we had such a line problem that we've been going, our dishwashers last us about 12 years, and then we had to, and we buy commercial, but we got Susan and her diligently looking for grants at all times, got us a grant for both of those things.
That was a brilliant idea. That we can't afford the windows they recommended, but
There's more programs coming out of the state, I think, that'll be available.
I'll keep looking at that website.
We have an energy task force that has been formed. Councilman Bayer and myself are on it, and a handful of others, and I know the mayor's going to be adding folks to that.
Maybe.
So we'll come and find some programs to try to help them.
That'd be great. That'd be great.
Pete?
Thank you, Mayor. Just piggybacking on Mary Jane's comments as well, thank you, Susan and Bill, and your staff. I mean, just wonderful thing you guys do for the children, and allowing parents that by any other means couldn't become employed, giving them the opportunity, the ladder up to them. It's just a wonderful thing you guys do. One of the things that I do commend you on is, even though, noting in the supplemental, even though you lost 47,000 enrollment fees, due to the kindergarten all day here, you're still able to come in and request the same amount, so that's, kudos to you. So I just wanted to say thank you.
Thank you. Walter?
Pete stole my thunder. I wanted to say kudos too. If we could give them more money, I would love to give them more
We'll
money.
take it, Walter.
We're saving the taxpayer down, well, it would cost the taxpayer, 42 years, 20% of the population, 3,000 families. But what this center provides saves it would cost the taxpayers close to $100,000.
Well, don't forget too, Walter, that the taxpayer is helping them
Yes, we are.
with additional support with regard to
understand, but I
the
tell
health
you,
insurance.
it's absolutely fantastic that we can do that, and we should do that.
So we have the employees at the Children's Center on the town's health insurance plan.
Right.
So that too is not just this
Phenomenal.
cash here.
We wouldn't have the kind of quality staff we have if it weren't for that. That benefit is, I mean, they don't get paid anything, but having full health insurance, it's really bad pay.
But if anybody knows anything about childcare, and if you look across the board, and the states have done, studies and stuff, that they do not get paid as much as they have to now, being so well educated. You compare it to the public schools and what they get paid. So it is a labor of love. The teachers definitely do it.
Every one of our staff qualifies for the sliding fee scale.
Well, I didn't want Walter to feel that.
I've been there. I understand sliding scales.
And just as a little last minute aside, I think it's something the town should be extraordinarily proud of. In '86 or '87, an organization was formed on a national level to set the highest standards for preschools. It was called the National Association for the Education of Young Children, referred to as NIAC. And it is really high standards, really hard to get. And New Milford and the Children's Center has the very first preschool in the entire state to receive national accreditation, #1 in the state, and 112th in the nation. There are now thousands, but this town has the first in Connecticut to receive national accreditation, 112th in the nation, and once you get it, which was in 1986 or '87 for us, they come back and renew your accreditation. You don't just keep it, they come and test it. On our last cycle, there's 10 standards against which you're measured. We got 100 or 100 plus in all 10 standards. So you've got a really quality golden nugget here. And if it weren't for this town, it wouldn't be possible. So thank you.
Here, here.
Okay, any other questions? Thanks again, you guys. Okay, item 12 is the discussion of the registrar budget, page 99.
Good evening, everyone. Driscoll.
Marcel Grenier. Good evening, everyone. Good evening.
This evening, as far as the registrar's budget goes, if you look, we have one change from last year, and the change is we added to our election personnel line $2,000. I will explain the rationale behind that. Last election, which we had in November, was the first time we had election day registration, which is going to obviously go forward. We have to bring on other people in order to do that. It's not done at one of the polling places, and it's particularly not deemed a polling place because of how it's handled as far as election day registration. So we do have to hire people to operate that function. That's approximately $400. It's only 2 people. The other $1,600 is, for some reason, New Milford, and I don't know why, when we have an election and there's an audit to be done by the Secretary of State, and we have a random drawing of 10% of all of the balloting, all the polling places in the state, of which last time there were 660, somehow New Milford, of the 660 getting 10%, which is 66, got 3. So, and that costs us money to do that, and we have been lucky, so to speak, the last 4 times when there was a possibility of an audit, to be audited. Our audits always come out good, and I wonder if that's why maybe we get lucky, because they like to have towns come back, the audits come back good. We're off of maybe a vote or two, a lot of them were exactly dead on, and I'm sure that that helps their numbers. This is only my guess, but anyway, bottom line is there's $400 for EDR is what the buzzword is for election day registration, and $1,600, which is about the minimum to run an audit, which we seem very fortunate to be able to do year in and year out. So the last 4 years we've had an audit, so just year over the budget.
Any questions for Registrar? Pete?
Thank you, Mayor. Thank you, obviously, for all you guys do, and your staffs, 6 to 8 at the polling district. Especially with all the new changes. Just want to say thank you. A lot of other areas had issues with things that happened, and New Milford didn't, so kudos to you guys. Just wanted to say thank you.
Thank you, Peter.
Tom?
Thank you, Mayor. Thank you, gentlemen. Just a quick question about the materials and supply lines. Within it, I mean, do we need to change memory cards every year, or things like this? I mean, we seem to over budget this a little bit, and I know you guys are trying to be as frugal.
Frugal is the operative word, yes. And we do. If we don't have to buy it, we don't. We did do some improvements a couple years ago. We bought a couple of desks because the desks were just shot. We didn't do anything this year where we would expend that kind of money, so we will have probably extras. Keeping in mind that the ballots, when we have to order them, have to come out of that budget. There are fees to program the memory cards. They have to come out of that budget. So, you see that we're budgeted for 3 referenda and a primary and a general election. So the expenses to do all that purchasing is built into that. So if we don't expend the money for, another 2 referenda, then we have extra money. We should, because we're not spending money for the ballots.
Technology-wise, in your office, are some of the computers up to date? Have you guys improved some of that?
We had 3 of the computers updated last year. There's one that's not mine. So the computers we have now are okay. Mine works okay. Is it due? Yes, it's probably 8 years old, maybe 9. So it's due to be done. We work very well with the computer guru, and he set us up last year for the 3 new ones. So we're good right now.
Okay, thank you.
You're welcome.
Katie?
Just a quick question. The conference/training, ROV, conferences and training, do you both or all, your alternates, who goes to it?
We all do.
You do?
All 4 of us, yeah. And what we try to do, if we can't meet all the days, we alternate dates. That way, when we come back, we talk to each other about it.
Right.
We always all go to that.
And the moderator training, who does that? You guys do that?
Our head moderator does.
Well,
Well, the moderator training, actually, we usually try to get Judith Bedreau in. She's from the state, and she comes in and does that.
So they all get together one day and get trained?
Actually, we have them coming up tomorrow night. It's going to be, we're going to update some of our moderators and stuff.
Good, thanks.
But the state does that. It's a ROVAC group, Register of Voters, which is, it's made up of exactly what is Register of Voters, throughout the state, and they come in and they train us.
there's only 2 or 3 in the state that are qualified moderator trainers.
Thanks.
You're welcome.
Any other questions for the registrars? Not at this time. Thank you very much.
Thank you.
Yeah, have a nice evening.
Item 13 is the discussion of Commission on the Arts budget, page 155, and in your supplemental, page 25.
Good evening, I'm Diane DeReal, Chairman of the Art Commission. So we've had a fairly busy year. We did 5 concerts on the bandstand. We had concerts at the railroad station. We participated and helped several area arts nonprofits, including Merlinsville Hotel Restoration, the Village Center for the Arts, Mariel Center, and the
Historical Society. We did ask for sponsors for our concerts. This year, we were able to get 2 sponsors. We're hoping we can do a little bit better this year, but it's really tough trying to raise money for anything right now. And as you know, we have a new gallery at 25 Church Street that's allowed us to provide a visual arts venue that we haven't had for a long time. And it's been fairly successful and encouraging in that artists are returning to a community who haven't really participated here in a long time and doing it in a variety of ways. They're doing painting and the obvious fine art things, but we also have scrapbooking and a variety of other more crafty type creative endeavors. And yesterday we hosted a Girl Scout troop who earned their fine art painting badge, and that was kind of fun. So if you look at our budget, you'll see that we are asking to be reinstated to $15,000. I believe we could use every cent of that with the gallery, and 5 concerts again this year in August instead of 4. So that's all I have to say. Any questions?
Thank you. Pete?
Thank you, Mayor. You kind of answered my first one, which is kind of an update on the Gallery 25 and how, you know, how you thought that was going. I've heard from different people they love it. That's
It's been terrific.
good thing. Yeah.
It's also allowed us to, just by being in town, we see people walking around and coming in. We're collecting signatures and zip codes. And we're seeing people from all over. We've had people from Australia and England and all kinds of places that I never would have expected to just be walking around town, and they happen to see the sign out and come in. So, you know, that's been a joy also to be able to share our community in that way, you know, with people from far away.
And not to hold you to it, but in your opinion, could, with this kind of being the incubator, could this be an area where you could see some growth with artists actually coming and wanting to reside here and maybe build their business here? Has anybody talked to you about that?
We have had some people come in, venues in their own communities have closed. They've walked around the area and seen that we have some empty storefronts, and they've asked about that. In a different way, we had one of the volunteers in the gallery is interested in putting together a community art walk, which a lot of communities are doing. It helps us partner with merchants in town in a sort of low-key, interesting, educational, artistic way. So, yeah, it is an incubator, but who knows what the future will bring.
All right. Thank you. Thank you, Mayor.
Thank you. Katie?
Thanks, Diane. Just a question. What are some of the self-sustaining programs?
Self-sustaining program.
Well, you have a line here, self-sustaining programs, it's $500.
I interpreted that as being, that's an area where we raise money. I don't think of it so much as.
That's what I mean. What are some of those? In what ways do you raise them?
We ask for donations or sponsors for the concerts.
Oh, okay. All right. So your programs and that sort of thing. Good. Well, I can't say enough about what I think personally, how wonderful Gallery 25 has been to add to what was already here and really expand on it. And to a person, anyone who I know comes to visit and will come downtown, they are thrilled about it because it fits right in with the whole look. You know, it's not too fancy, it's not a new space, and the programs and the lessons and things are great.
Okay.
So thank you for all you do. I don't know how you do it with so little money, but you always manage to. So thanks.
Thank you. Tom?
Thank you, Mayor. Very nice to see you. I hear some very good things about the gallery as well. Do you see in the future any revenue being generated at this gallery to offset future costs? Is there a revenue component here?
Well, we're teaching classes, and we also, we just began staying open on the third Thursdays to cooperate with the downtown merchants. We have a group that's coming in that they're doing a writing workshop. It's been a very small group. They didn't know how to get started. So on that Thursday night when we're open, like they're going to be in the studio area doing a workshop, and they make a donation per person to be year, so that'll help offset some of the costs for the gallery. The other thing is, it's really just the classes, I guess, that seem to be the thing that are most attractive, and that adults are wanting to try the arts, but they want to be in sort of a, you know, a non-competitive environment, and feel like they're not doing something weird, you know. But we've had some great instructors, and there are people inquiring about teaching classes. We're only open Thursday, Fridays, and Saturdays now because that's all we can manage with volunteers, you know.
Have you seen, with the building being done next door, the Ezekiel building, is there any crossover traffic, people that are coming to visit their showroom or going in, stopping in? Have you noticed anything like that?
Not yet. We know they're there, and I think there's something happening. I mean, people come by and they peek in the windows and stuff. I try to get them to come in, but, you know, it's not always successful. So no, I haven't heard a lot about that yet.
And he hasn't had his grand
His grand
opening
opening,
yet, and he hasn't done shows yet either, so they have a cooperative spirit going. But I did want to add that Diane and the Economic Development Commission chairman are working to have those two commissions work cooperatively with the downtown this summer and this spring for events and different things of interest, so that's yet to be.
In regards to your concert series, have any of the programming changed or been augmented a little bit to attract a little bit younger crowd into town? I know you've had some stalwarts there over the years.
Right.
Has there been any additions to the lineup, let's say?
I think we had two different groups last year. We have two concerts that are not set this year. We have a new member on the commission who's looking into doing something that would be more youthful. I mean, he's volunteering his time into this, but the plan hasn't come together yet, so we're trying. We certainly have had a lot of people contact us. They're not all exactly have the finesse that we would hope to have perform on the bandstand, but there may be a place for them, and we don't know yet. You know, you collect a group of names and performers together, and then eventually you can make something happen, so.
Because I have seen, sometimes driving at a certain, they have I guess they call it a drum circle.
Yes, we're gonna have that again this year.
Yeah.
And we have some lady drummers who are gonna come during the art show and bring for the Historical Society does, kind of an interesting little change of pace, but they took off with the drumming, and now they have their own drum group, so. Drumming group.
Have you done much via social media to continue to spread the word?
We have a Facebook page, the gallery has a blog. One of the things we hope to add this year would be to have the Art Commission have its own website, and the Facebook page and the blog could come as part of that, be in addition to that. But it's just slow going. I mean, it's hard to do everything at once.
Thank you very much. Thank you.
Thank you, Gail.
Diane, I just want to say thank you and all the commissioners for the wonderful job you've done over the years. The things the Art Commission does are kind of what takes this house of New Milford and makes it a home, gives it that touch and character. So I just want to thank you all.
Thank you. That's very nice. Thanks.
Thank you, Gail. Beth?
Again, to echo everyone else, you guys do a great job in considering it's a staff of volunteers. It's amazing what you guys have accomplished. I was just curious, did you ever think of doing a larger scale concert or anything, say at Fire Valley or any of the other parks other than just on the green?
As I just mentioned, one of our newer members is interested in doing something with a younger group of performers. He actually recommended we look at Youngsfield Road, but he's new, and there's a lot that needs to take place and be put in place to have something like that. So, yeah, of course, we consider that. It's also a matter of manning, having enough volunteers to do that, and we probably would ask for volunteers from the community to help us if that came to be, so. The answer is yes.
Appreciate your
Thank you.
And the other thing with regard to those concerts is Bank Street LLC is going to be sponsoring concerts on the bandstand by well-known cover bands on third Thursdays. Is it 5 months, Tammy? I know it ends in October, so it's June, July, August, September, October. Every third Thursday have an event, and they're trying to get the local merchants and the commission and the arts commission to have that, so that everybody knows there's something going on. It's gonna be fun, it's gonna have music, so, that's already scheduled, the dates are all blocked out, and those bands are hired, and they're my daughter's age, so that's 30. Oh, she's my friend now,
She's your
she's
friend.
too old. This is 32, I was at 32. But, so that'll be fun, and everyone's looking to work together, so, I think it's coming along. Other questions for Diane? Thanks a lot, Diane. Appreciate it. Okay, item 14 is the discussion of visiting nurse association. Page 135 and page 8 the supplemental.
Good evening, I'm Andrea Wilson, it's a pleasure to be with you here this evening, and I brought our board president, Rich Kosher, as a good supporter for me, and he'll fill in, like, hopefully I don't forget too much. What I wanted to tell you a little bit about what we've done this past year. We've been very busy, very aggressive as an organization. There's obviously a concern in healthcare in this country, in the new changes in the healthcare law, the cuts that we're anticipating in Medicare, some of the changes that we've seen at our local hospital as far as the decrease in the number of patients there. So we felt, and the board was very strong about this, that we needed to be aggressive in what we offer to the community and some of the changes, and really looking at our financial well-being in the long run, and that was crucial because we've been here 96 years and we plan on being here another 96. Not me, but the organization. But let me tell you what some of the things we have done, just quickly. This is, I'll start by saying, tooting our horn, this is again the 8th year in a row. Last year we were again voted one of the top 25% home care agencies in the United States. So that's 8 in a row, and that's the only time they've really measured this has been the last 8 years. So we have made the list. It's really a small number, less than 1% that have done it all 8 years, 4 of which were in the top 500. Another thing that we did, which we felt was very important, we began a private duty business, a not-for-profit, a 501c3 private duty called V&A Home. Why we did that? We really felt that some of what in readmissions to hospital, we need to have some direct control over the aides, the homemakers, and the companions that are within the home that we can supervise. So we wanted to make sure we had some control of that so we could manage those readmissions and actually manage the total health of the individual within their home. We also felt like this was a possibility for those that could afford private duty, because private duty is pay, that we could eventually make some money from this. And what we always propose to do as an organization is any money that we make, we really plow back into the organization. And what we hope to do, we've developed a low-income fund, and even from money we make, we'll work with private duty patients in the future too. They cannot afford the assistance. We will either assist or help in some way based on a formula that we have. In addition to that, we started a geriatric care management program, an extensive one with both RNs and social workers. This also is starting out as a pay, a retail business, if you will. But hoping, because we see the need, this is a crucial need that I'll talk about, that really we would love to offer this to everybody in the area. We start out right now, when we're doing this within our organization, all Medicare patients automatically receive a social work referral. So our social works go in, this is something new, they go in, they assess the patient, and our social workers don't go in, and a lot of people think it's something to do with behavioral. It actually is not, it's not a counseling program at all. What they go in and do is work with the patient on long-term planning and assistance, financial planning that may be necessary for them to continue their healthcare needs. So that's really what our social workers do in this program. So everyone is, we have a referral. In addition to the medical needs that we do, we send the social work out. She talks about, what do you have available? Were you a veteran, you might be available for this, what would you need to do? There's a whole program of what they might be eligible for and how we might assist, or we talk about the community availability of services for them. We also have done, in addition to social work, what would happen after that, after this initial review of Medicare, once they are no longer Medicare eligible, and Medicare is a program that's intermittent and short-term, so it's not chronic and custodial, and a lot of people that really need assistance are the chronic and custodial long-term care patients. So for those that can afford it, we will continue, the social worker will continue on, if they want, to help them fill out an application that may be necessary to assist in, if someone needs meals, we will be the conduit for trying to find what might be necessary. And those patients that can afford it would pay on an hourly basis for what we have. The second part of that is our RN, Geriatric Care Management Program, but we like to call it our concierge nursing. And what that is the same thing. If you can afford it, and your son lives in California and mother is here in town, they could possibly pay for our nurses to accompany. And this is done 24 hours a day, 7 days a week, whenever we're on call. This is not just 9 to 5 nursing. We're on call that if the son calls and said, I'm concerned about my mother or my father, can you go over and see them? We'll go over and see them. We charge by the hour. If they have a doctor's appointment, our nurse will accompany them to the doctor's appointment, if the family members can't attend. If they're in the hospital, our nurse will go in the hospital, review the record, make sure, in fact, what is supposed to be occurring with the patient and the drugs and the shots and everything that maybe need, they're there to be the patient advocate. And since they have a nursing clinical background and understanding, we think with elderly patients in the direction it's going, that's crucial. Those two programs we believe the entire community need. They need help in doing a lot of this. So we're going to spend time fundraising and working on receiving any additional money we can to supplement some of these things. The other thing we've done is we're becoming certified as an agency in diabetic care management. As many of you know, the hospital gave that program up. And they gave up the individual who was extremely well-trained, unbelievably well-trained. We hired her 25 hours a week. So she is doing a lot of the diabetic care management. In fact, she was just at the senior center this week and did an entire program for the seniors, and they were just thrilled. So what we're going to do is offer not only to the community, but the physicians, so that when a patient needs further information, for their further training, we will go out to the physician's office, meet with the patients, or they will come in and meet with us. So it's really going to be a comprehensive program, and we think diabetes is a huge issue for most of us as a chronic condition, and that we need to help manage that for the health of the entire community. So we're doing that. We're doing lots of little things, like we're starting the walking club on the green. On April 1st, I think, we're getting the whole community involved at 10:30 in the morning, so I hope you read it and come out and walk with us and maybe do that on a weekly basis. We're talking about that. So you'll find out. We're talking to the senior center. We're getting everybody involved. Everybody, and that's one thing we're trying to work on. So it's programs like that that we're really trying to reach out to the community, be aggressive in good health, really looking at wellness, because I think this is the issue right now, that we need to concentrate on that. Because on the back end, we're not sure how much Medicare dollars are going to be available. And if we can keep people healthier in their own home, I think we'll save everybody a ton of money.
Thank you, Beth.
I can't say enough good things about you. I've seen through when I worked at the hospital and even talking to people who you have affected with the work that you do, it's phenomenal. So thank you so much for all the efforts that you do. I know last year you mentioned the potential of a hospice. Where are we with that? Is that something that was a go, or is that?
Well, what we wanted to do, and we started out with the private duty company, we want to make sure we have enough aides to be able to take care of people 24 hours a day, 7 days a week. So that was really a first step. And that is something I think we want to look at. We're going to pursue what we can do to make it a total community effort. So I think hospice is in the near future and expanding it.
Thank you, I appreciate everything you guys did, great job.
Thank you, Katie.
Thank you for everything you do. A couple questions. You had mentioned, I think it was last year, maybe before, about the electronic monitoring and how that was expanding. Is that still growing, or?
Yes, it is. It's growing. All of our machines, in fact, are out. And what we would like to do, and that's another thing we're gonna try and raise some money for, is to purchase additional machines.
Good to hear that. And you have some, I know about a lot of these things you do now. This concierge service, as you call it, is probably the thing that most of us could use now or will shortly for our parents, et cetera. Is that across the nation? Other VNAs do that?
No, we're
That's what I thought.
we're being leaders in this.
Yeah, and now you have some.
In fact, I'm speaking about this program to, in San Diego in a few weeks. They've invited me to speak about it.
Go to New Jersey, but
San Diego.
I can't wait to get some more.
Yeah, Katie.
Really?
San Diego, come on.
no, but when she's done there. But I had some experience with you in your, hospice care and that kind of thing, and it's absolutely wonderful what you do. But do you have sufficient people, staff, resources for all of this? I mean, is there still a?
What's surprising is I thought when we opened the private duty, there was some concern on my part of where are we going to find quality people to do private duty. I'm astonished at how many people are looking for work that are quality people that are doing. I wouldn't say it's work beneath them because it's wonderful work and it's rewarding work, but it may not be what they went to college for, and they may not be making what they originally thought, but they receive, I think, a different kind of benefit, and these are special people. We have some amazing people, and in private duty right now, we probably have at least 12 to 15 people working, and we hope to expand that.
Great. Thanks.
Thank you, Joe.
Just full disclosure, my wife works for a VNA.
It is very good. In full disclosure.
Okay, Joanne?
For this, you were talking about difficulty in getting people, or are you finding a CNA or a home health aide shortage? Because we've been hearing the hospitals are having a hard time.
Well, in fact, we've gotten quite a few people from the hospital, thank you.
I just said that.
That's what we figured.
That's why.
So I can honestly say, and I'm really concerned, some of the nursing staff, the quality nursing staff that we have gotten over this last year is really tremendous. And right now, I'm sure it's due to the cutbacks that have been in the hospital, the fear, the concern, that type of thing. So I'm glad to say that those people are still working in our community and still having offering.
Do you work with the hospital at all, like with the 30 days, trying to keep the patients out for at least 30 days, et cetera?
Well, that's what I talked about with some of the readmission rates, and that is going to be a big concern from Medicare. If the hospitals don't keep them out, they're going to lose money. So it's really incumbent upon us to help them to not readmit. And that's why we're going to do some of these extra things for people to make sure that we have a total handle on what they're doing, that we're available, that we're on top of it before it gets to the point where they have to be readmitted.
Are you finding that everyone's cooperative, or are you having a competition, or, the market's getting more and more competitive?
We're a little bit different than most of the market because we're not for profit, I think, and then what you find in some of the other markets, some of the other programs are really for profit that have come in or have started a business. So it's a different kind of niche, and I can say we all have our own, and at this point I think the providers that we have in the Milford area are wonderful, and we work together very well. And there's been really enough work for everybody.
And thank you very much for starting up the diabetic program, because we were very shocked when they
I was
did that, and you hired Diane Cook.
Yes.
Yes.
That's great. So
Yes. She's out there, and we're working, and we're really going to help physician offices because they can't necessarily afford a full diabetic. So if we're providing it for them, we can take the referral, it can still be their patient, we can all work together, which is our goal. I mean, that's what healthcare should be. It should be a continuum of care where we're all working together in the patient's best interest.
Okay, thank you, that's great. It's exciting. The changes aren't all bad, and if people can figure it out, it's gonna be good.
And that's what, thank goodness I have such a wonderful board. They have been supportive all of the way in making sure that, we really do things that need to be done for our own survival and for the benefit of the community. I mean, that's what they're here for.
Councilman Walter.
Again, I just want to say kudos to another people program in our community that is just absolutely outstanding. I also heard that the director has, or the local leader has become a very good friend of Santa Claus.
Yes.
Isn't that true though?
Yes.
Yes, okay, I'm over it.
We would like to actually do a campaign next year that says, if any of you have seen a few people in the room have their picture taken with I Choose New Milford VNA, we hope to have Santa Claus holding up a sign next year, Christmas time. Now, you can't argue with Santa, can you?
Thank you. Pete?
Thank you, Mayor. So all the other council people have said, just kudos for your work and your efforts. I did have a couple of questions. One is, as a percentage, how many New Milford residents versus other towns do you work with as far as clients?
Oh, by far the majority here is in New Milford. The other towns really are minimal compared to that, but I'd say 80% of the people we take care of.
And what do you see as the number one overriding need that they have?
I think the overriding need is confusion about where to go and what to do and what are they going to be eligible for. It's just a lack of knowledge. And many times we see people, examples, no one explains to them that they may be eligible for a veteran benefit. And the Veterans Administration doesn't come out and tell them that either. But if they were serving during war, they are. And then their wife, if they're not alive, the wife is due for half the benefit. Many people don't apply. Or the applications are too onerous, they're too difficult to fill out. So, we're hoping to have staff available to help people through those kind of issues.
Thank you, Mayor.
Thank you.
again.
Thank you. I
Mary Jane?
appreciate it.
Andrew, I just wanted to ask about your geriatric care. How many patients do you have or clients do you have in that right now?
Well, as far as the private pay section of that, I think we have 5 or 6.
Okay.
And we just started it last fall in November. So it's working out very well. We have some patients that oftentimes have trouble with medication. So we will go out there and make sure that it's poured and taken care of and monitor. And it's really helpful for some people to have some place to call. So they're not calling the physician's office, and actually we're making good friends of the physicians, because patients that are having difficult times, they can call the nurse, she can go out there assessing. I think that's eventually what's going to happen anyway, is physician's assistants and nurse assistants are going to be the first line of health care, and our physicians are going to end up looking like specialists and only come in when someone else can't figure it out. So we're trying to also train our staff to be able to do that.
I have another question. Is the hospital or case management referring patients to your diabetic care?
We're the only game in town, so I hope they do.
Okay.
I know the physicians have been very supportive.
Great. Thank you.
Thank you. Tom?
Thank you, Mayor. Maybe I want to echo the sentiments of everybody else. The work you do is great. I've had personal experience with it with my mom. To follow up on a question that the Chair of Board of Finance, Ms. Jacobs, brought up, CNAs, your certified nurse assistants. Have you worked with places such as Naugatuck Valley Community College? They had a wonderful program there last summer. The former economic development supervisor and I did a tour of that facility.
Yes.
And the president of the college, Daisy Filippo, said, if you can give us some space, we will set up a program to train CNAs in your town.
In our community. Yeah, that's something that I think I've heard of that program, and we will be looking into that over the next.
They were very encouraged about the opportunity to do that here. And I've never toured your facilities, I don't know if there's a classroom there.
There is.
Or something
So
that,
please come over, any of you,
I
anytime.
would love to get the two of you together and Mr. Trowbridge, who is their, their executive.
Can I get one of my cards and hand?
Absolutely, yeah.
And
'Cause
then we'll talk
they
about
were-
setting something up
They were
locally.
very enthusiastic about it. I know there's a lot of folks looking to enter the workforce, young people who would like to get into the healthcare field, but don't have the ability to go to a full nursing program.
And if it's in their backyard where they don't have to travel,
Exactly, it's a
they're
difficult.
more inclined to come.
Right,
Yeah.
right.
No, we have some good people in the area that need jobs.
That would be great, absolutely. Thank you.
Board of Finance, Walter.
Again, I want to thank you for all the work you do, especially hiring Diane. Question about the 501c VNA home. What level of care is private duty? Is that all the way aides through to nurses or?
No nursing. Yeah, it's not a nursing program.
Okay.
That's why we have the two, they're both 501c3s, and we are actually the owner of VNA Home. But we've kept it as a separate organization simply because we don't want to mix the certified, which anytime you're dealing with Medicare, as many of you know, it's onerous and it's convoluted, and it's not very simple. So we're trying to keep the aid side, which is the homemakers and the companions and the certified nursing aides, trying to keep them separate and keep it simple and not involved. Yeah.
Okay.
Yes, but the concierge nurses, that's what I'm saying, so it's really coming out of our side. And what we found, a lot of people like it there because they want to make sure, our patients will flip in and out of Medicare. So what we can do in this situation, we can give them continuity of care. When they are eligible for Medicare, we will put them on the Medicare program. Because technically, we get more money than if they would pay privately. We're not charging a large amount of money. So we'll do that, and then when they're not eligible, we'll discharge them, we'll continue to follow them as necessary when they again flip back. So we found that has been very helpful with physicians in the area, liking the fact that they're not turning the patient over to a private for-profit organization that may not refer back to the Medicare certified side for the service everybody's entitled to. So we really find it a good mix, but we're very diligent about the paperwork and the policies and procedures and making sure that when someone switches over to the private pay, that they're no longer eligible for Medicare.
And you track readmissions of those patients at the hospital, that they come out and you pick up and within a 30-day window?
Yeah. Part of what we do, we're going to do extensive longitudinal studies based on readmissions from both our private duty, because technically if you have a good private duty group of employees, they're the first line to keep them out of the hospital. They're the ones making sure they're eating, that they're taking their medication. So we're following that. We're following the nursing. We're just making sure all of that revenue and that we're in fact doing good outcomes based on that.
Any other questions? Thank you.
Thank you very much. I appreciate it. Thank you
Good
for
job,
all
Rich.
the good comments. Good moral support.
Okay, item 15 is discussion of the Health Department budget, page 103.
Hello, good evening. I'm Mike Preston. I wanted to go through a handful of changes to the health department budget, some pretty minor, some a bit more significant. The 270-4 account hepatitis B vaccination, there was a small reduction. We're not seeing a whole lot of demand right now for hepatitis B vaccine, and actually I think it's because a generational thing. We've had a generation of people that have been vaccinated, so I mean that usually comes up when there's a new ambulance employee, or also we work with the school system, and I recently found out just in the last late last week that the school system is now using private physician for their Hep B program. So we could probably, if you saw the need, cut that in half to $400, which would provide 10 doses, and I think we can get through the year with that. Also a small increase in the 2709 account, environmental inspectors, or a small increase. That's just because we gave the inspector, that's for the restaurant inspection program, she received an increase to $32 an hour times 4, 125 hours. That's about a 600 hour a year program. So we internally do about 30% of that job, and that covers 70%. That's an offset from income we receive from the town of Washington for the contract that we have with them. The health B&A account 27010, there's a moderate increase to 11280 from 9600. That mostly is reflected from the lead grant that we received a sizable lead grant this year, and I expect that to continue for next year. And we want to cover about 48 hours of B&A time in addition to what is already being done. The household hazardous waste account 27011 increase, significant increase there because we've gotten a verbal commitment from Bridgewater and Roxbury to participate with us this year. So that increase, that would be income that we would receive. So it's really an offset from Bridgewater and Roxbury. And then the last change is the Public Health Emergency Preparedness Fund 270-12. That's a decrease because we're expecting a cut in the grant for next year. This year, the grant amount is $54,723, and we're expecting about a 35% cut, although again, there's some uncertainty with that, and I'm now hearing possibly that would be level, but I think I'd like to keep that at a 35% cut. If it does stay level, then I suppose I would come back and ask that funding be restored to the budget. I don't really know for sure what's going to happen now. We don't find out usually until about June. So those are the changes in the health department budget. I don't know if you have any questions.
Questions for Mike? Beth?
It's just a comment, again, I see you out in the community all the time, all the education and outreach that you do and your department does, it's a great job, so keep up the good work, appreciate it.
Well, thank you, and there's a lot more that we're being asked to do this year because we're involved with a grant from the Torrington Area Health District as a fiduciary for that. It's called the Community Transformation Grant, so we're going to be doing a blood pressure self-monitoring program together with the VNA and some physicians in the southern Litchfield County area. And we're also working with a community health needs assessment through Western Connecticut Health Network, involved in some healthy eating and active living programs and tobacco-free policies. So there's quite a bit going on.
It's great, thank you.
Sure.
Thank you. Katie?
Thanks, Mike. A couple questions. The restaurant inspection, how, you don't put something up in the window that they do in some metropolitan areas, right?
No.
We've been through this.
Well, I'm gonna say why, because someone asked me, how would they know, because they made a comment, oh, they didn't look like a good place to go. I said, no, it's perfectly fine, the health inspector gets there. So, they wanted to know, how would someone know, as we bring more people into our town?
We've been posting them on our website, and also if anyone were to call, they can obviously, but that's the old way of doing things.
Yeah,
But
I mean, if you're walking around in the town, you kind of look for that little A, B, whatever.
Yeah,
I think you might ever do that.
the mayor asked us to implement
Oh,
a
really?
program like that years ago. We tried it for a while. The problem that we saw, and I know that New York City is probably the most prominent one that's out there, and they have all the grades in the windows, but we had a certificate program, and we were giving certificates, but then what we found was that if we gave someone a certificate, then they fell backwards some. We couldn't just go and yank a certificate. It was more of a voluntary program. I think that New York City's is by ordinance, by.
Well, you get fined if you don't present in the window, I know that, but
Yeah.
I just was curious if it might ever come. I realize we're quite a ways from that population. And just want to know, how are things going in the fight against bed bugs?
We do have.
It's a problem in
It
town.
is a
better
problem.
than last year.
We do have some cases of bed bugs, usually they come in by complaint, and they're difficult problems because they're expensive, and many times they're low income, situations. So we have to work with the landlords, we work with the exterminators. They can be very time consuming to resolve, and they can be very difficult to resolve.
But you don't see it escalating.
I don't see it escalating, no, but we do have some, one or two, say 1 to 3 cases of bed bug issues a year. I mean, it's definitely back, and I think here to stay.
Yeah, I didn't like
I mean,
to
we
see
don't have
I know,
we don't have terrible problems with bed bugs, but they do,
How do you find our local inns and motels and things? They okay? Do you inspect those?
we do, but
Oh, please
mostly
say
by
what I want.
complaint. Some are down here and some are much better.
I see.
But,
Is that on the website as well?
no.
She wants to know where to put up her out of town
That's all right,
gas.
I'll stop it. Thank you, Mike. You do a great job.
Great job.
Any other questions? Gail?
Yeah. Mike, would you just give me the Reader's Digest version of what's covered under public health preparedness?
That covers a lot. It's been going on, it's about a decade-long funding now for that program. We've written a multitude of plans. We do a lot of drilling and training. There's a regional effort as well as a local effort. This year we're going to be doing some drills, and but I mean that's the Reader's Digest version of it. It's a lot of planning, preparation, supplies, resources, working with other HEFCO partners. We're in Region 5. I was the Emergency Support Function 8, which is the Public Health and Medical Emergency Support Function. I was the chairman for Region 5. Region 5 is all the way to the Massachusetts line over Waterbury to Ridgefield. So we have an RCC, which is a Regional Communications Center, to provide mutual aid, mutual public health aid. We work with the hospitals to make sure that we're in coordination and in sync during emergencies. We've been doing a lot of work lately with sheltering. Sheltering is a big nut to try to get your hands around, and there's a lot of communities around the state that are doing it much differently. We're working now with a special needs project in the HEFCO region, because you can't, it's a good idea to have some of the special needs population. They have different needs than the regular population, so you have to provide oxygen and toilet care and those kinds of things. We responded in emergencies and to test our systems. So, I mean, public health emergency, and then of course mass vaccination. We're the mass dispensing area at what number are we? Number 8. So we're the lead. New Milford, New Fairfield, Washington, and Sherman. They try to have the mass dispensing areas be about 50,000 population. So during H1N1, the outbreak during 2009 and 10, we got to use a lot of our systems and what we had practiced to see, what some of the successes and failures were, and we're always trying to improve, rewrite plans. We wrote a mass fatality plan last year, which is not fully developed. We want to refine it some before we, really, that's a difficult issue as well. The state has been trying to work on that mass fatality, but hasn't gotten very far, so we said, well, let's write our own and go from there. So maybe that's a little beyond the Reader's Digest.
The long Reader's Digest, the novel. Any other questions for Mike with regard to the health department budget? Then we'll move to the local emergency planning budget, which is page 219, which is still Mike. That's his other hat.
Yes. The local emergency planning committee budget is the same. There's just a change to some of the lines. The main things that we do with LEPC, we meet bi-monthly. And the communication van, which is a communication of last resort, they have ham radio equipment and they have a lot of handheld radios, and we're now looking for an antenna for them because through the last round of communications they lost some of that capability. I mean, they still have some capability, but we want to get them restored fully. So we support that, and we also support the CERT. One of our big successes last year was, and the question came up during this part of the budget last year, was the shower at our main shelter, Sarah Noble School. We got the shower built last calendar year, and so we don't have to transport people for showers to the high school or have them hosed off with the
Firehouses,
yeah, with the
cold water.
so that's done. There are 2 showers, of course, male and female. If you're at Sarah Noble School, have a look. I mean, to me, they look really good. And there's security. They built a little cage and took the faucets off so the kids can't vandalize them. So I thought that was really great.
Will we know where the faucets are if there's an
I'm
emergency?
sure John Calhoun will bring them, forthwith as soon as
Very
we can.
good.
So the LEPC budget overall is level, and $5,000, and we purchase equipment, and as I said, the 3 main things: we support the communications van, we purchase equipment, and we support CERT, which, as you know, is Citizen Emergency Response Team. They do a lot of volunteer work at different events, emergency events around town, and they're our main sheltering volunteers as well.
Any other questions on LEPC? Thanks, Mike.
Okay, thank you.
Item 17 is discussion of youth agency budget, starting with page 111 and page 124 and 132.
Being a glutton for punishment, like,
So last year, remember,
right, we're gonna try one more time.
yeah, last year, if you recall,
This time I brought technical assistance, so.
yes, you didn't have support staff, just the equipment, so.
And who is your assistant this evening?
This is Matt Ashby, who helps us with our social media and the video project that we're doing. That's gonna happen again.
No.
Uh,
Now on
This year's budget, basically while we're waiting for the machine to warm up.
Could you introduce yourself, because you're on camera?
Really?
Just freeze.
My name is Mark Mankin. I'm the director of the New Milford Youth Agency. This year's budget basically is very similar to last year. The only increases, and I'll underline those for you as we go, are basically in self-sustaining areas. The areas that we actually are using the town funds for, not reimbursing the state of the state. We're required by the State Department of Ed to keep fairly rigid stats that are turned in every month. They're coordinated with statistics that they're collecting from the schools, and they're trying to look for trends in either problem areas or additions to what they need to require the schools to do. They've developed a system that basically culls out the duplications. And so given that, we basically served about a third of the population in New Milford last year. The last year program has 120 individuals a day. We have 180 kids. I'm just going to run through some of the highlights. The Substance Abuse Prevention Council this past year offered a program at the high school for 1,400 students. Parent University, which the agency runs, this year had 75 families. We did an assembly this year, this past fall, called DIRT, which has been very, very successful. We do it every other year. We had 1,000 students who saw it, and 200 parents who showed up that night, which is pretty amazing. And we're impressed. One of the high school students has developed a mentor program with Sarah Nova. Students that are having problems with studies, they come in on Saturday mornings. He brought all his friends from the National Honor Society down. We now have 40 kids that are receiving help at East Street every Saturday morning. He is unfortunately leaving this year, but is working on 2 other juniors who are going to take the program over. It's been very successful. A lot of cooperation from the school with it, which has been really great. The Juvenile Review Panel, which we do with the police department, had 45 cases this year. We basically run 21 different types of programming in the context of counseling, whether it be support groups, working with parents. And then finally, we're one of the largest employers in town. Between college and high school students, we hired 90 kids this past year. The one that I want you to take home with you is this. Of the entire budget that we're requesting this year, 62% will go back to the town in the form of revenue, $652,357. In addition to that, this past year, while meeting our requirements for reimbursing the town, we returned another $18,191. We consider that kind of interest on the money that we're utilizing. We collaborated with about 61 different organizations. Without the schools, the hospital, the police department, other town agencies, DCF, we really couldn't function. Being in the building where we are right now at East Street School is phenomenal because it gives us access to not only the administration but all of the buildings, and a lot of our programs run out of those buildings. It's very, very important. So it's when you're bumping into them every day in the hallway, you're developing relationships, and when there are problems or there are needs on both sides, it's easy to take care of. For intervention for at-risk individuals, we have the Substance Abuse Council, which is made up of the police department, the agency, the schools, and the hospital. And for the last 3 months, they've been working on the problem that we're experiencing, not only here, but across the state, the entire country, and that's heroin. And so they've initiated a series of programs, the first being a box that's going to be placed in the police department lobby. It's a lock box. It's basically monitored by I guess the Justice Department. They come in. You can drop your drugs in that box. You don't have to flush them down the toilet. You don't have to put them in the garbage. Because this is the start of the problem, prescription drugs. Doctors give too many of them away. They sit in those cabinets, and the kids know they're there. The problem, basically, is that it's $80 for an OxyContin. You can buy 4 or 5 bags of heroin for $20. It's cheap. It's in the area, and so we start with that. We're going to every one of the pharmacies and ask them to include, when they give a prescription for narcotics out, a card that tell the parents exactly what to do with this stuff when they're through using it and how to store it at home. The school and the police department have gotten together. The resource officer is going to hit every health class early this spring. Just 5-6 minutes of basic information about what's going on, so that as this unfortunately makes its way from Torrington, Waterbury, Danbury, into this area, at least the kids have some basic information. The Juvenile Review Panel, which, you know, most people I think are familiar with, we're still doing a lot of work with teen moms, both at the high school and using the MAX. A lot of parenting workshops, anger management classes up at the middle school. We do case management where people are allowed to come in with their families, sit down with one of our social workers, and then we try to find appropriate resources for them. We run a resource directory and teen yellow pages on the internet, which allows people also to access information. We have a crisis action team that we put together. It consists of professional counselors, psychologists, who are on call 24 hours a day if there's an emergency in town. We've only had to activate it once or twice since I've been here, but it's there. We do a lot of crisis intervention, and we run a lot of different support groups. And while I was talking, I should have been hitting all these little cute little things. We also do a tremendous amount of preventative programming in a variety of different areas. Again, we're running the health fair. We run student advisory boards, both for the agency itself and for some of the other programs that we're running. The mentoring program, great police grants. We're undertaking another one this year, bringing officers together with at-risk individuals to basically recreate together, but at the same time, complete a community project. Parent University, Summer Thursdays, which is a mini daycare that we run at East Street 1 day a week during the summer. And then, of course, we just talked about the local substance abuse council. A lot of community service. We have our work crews, which we re-initiated. We do the grad party. We do a lot of trail work now again in the area. We're getting very, very good at building bridges. We just completed our 42-foot hiking bridge for Wantagh on a piece of property that's shared by the town of New Milford. It has a really nice trail system on it. Renovating the graveyard at the border of New Milford and Brookfield. Doing a lot of historical research on it with the kids, learning how to patch the stones, find the stones. It's one of the oldest and most interesting. And occasionally we're seen on a traffic island or two, mowing or doing various other things. Bike day, where we're taking bikes in from the general public with the help of some pro bike mechanics, giving them away to low-income families. Maple sugaring, which is very interesting this year because last year we had about 105 gallons put away. We don't have a drop this year yet. It's just been incredible. The weather is, hopefully it's going to be very compact and everybody's going to work 24 hours a day. But yeah, we don't know what's going on right now. Helped rebuild the dog park last year with one of the police grants. And then just a lot of basic assistance to different organizations. When you look at the agency's budget, which is kind of a flagship budget, personnel stays exactly the same as last year, as does the fixed charges. The self-sustaining youth grant is a grant we get from the Department of Education, which we use basically to hire teenagers to do the work crews, to do other types of programs. We do the teen mom programs with it. We've used it to get our video project up and running. Sullivan Farm is the maple syrup project. Stays exactly the same. The grant of $1 stays the same. We get a grant from the state of Connecticut every year, which is what the Substance Abuse Council uses to run the programs that they offer each year. Materials and supplies stays the same. In fact, the entire budget for the agency itself stays exactly the same as last year. The MAX basically has its catering, events, a restaurant which is run on Friday and Saturday evenings. We have 12 high school students right now that are working with 3 different chefs here in town. It's interesting because quite a few of them are going on to culinary school. We had a chance today to kind of sit down with the school and talk a little bit about the possibility of maybe advancing that project. There's a lot of interest in it. Fantastic program in Danbury. But there are a lot of kids who don't want to go to Danbury. They want to stay here with their friends in their own school. So that's something that, you know, we're kind of looking forward to. Running events there on Friday and Saturday night, as well as the buildings used by the Scouts, the Park and Rec, the Senior Center, the Women's Club, New Milford Rotary is extremely generous in allowing us to make lunch for them once a month. The American Red Cross uses it for blood drives. Again, it's kind of like a community building. And then phenomenal catering, which has grown dramatically over the last year. When you look at the budget, again, personnel stays the same. One of the changes in our budget this year is that we've gone from 65 to 85,000 in the self-sustaining, and that's basically catering. What we're finding is that we're running out of money. You have to buy food, you have to pay people, you have to get the linens. While we're bringing money in and balancing, we need more money, just because it continues to grow. And we're seeing the catering end of it go back to where it was maybe 2-3 years ago when the budget was at 85,000. So we're requesting that again, but it's self-sustaining. Contractual services, which are basically police, who are required at certain events due to numbers, stays exactly the same. Materials and supplies stays exactly the same. Then we have Latchkey. We're running about 180 different kids each year, 120 a day at every one of the elementary schools. We're getting ready for the reconfiguration. The budget does reflect an increase, both in personnel and materials and supplies. Personnel is a result of the fact that we've had to conform with the school's security systems. So in the afternoon, when their guards leave, we now have guards that go onto the doors to protect the kids in the buildings. This is at Northville, Sarah Noble, Hill and Plain, and Pettibone. It's something that the parents demanded. Now you're required basically to buzz yourself in. This individual standing there with a list of people that are allowed to come in and which kids they're allowed to take. And so, again, while it's self-sustaining, there's an increase in that account because of these additional staff. We're also looking at another increase in the minimum wage. Every time the minimum wage goes up, every one of our staff go up like this, because it's kind of hard to tell a college guy who's getting $10 an hour that a freshman in high school is getting $8.75. So as the freshman goes up, everybody goes up, unfortunately. Materials and supplies have gone up because the state's requiring now that we have the buses that we use inspected every 90 days. And it's something that All-Star does. We've linked with a company here in town who does Kent and Canterbury. They bring an inspector in. It's not a question of driving to Weathersfield or down to Norwalk. And that cost is shown in there, but again, it's self-sustaining. The last account that we have is our capital, which includes electrical, the van lease, which is self-sustaining, and then the 5,000 that we put back into East Street School every year. It's our way of kind of paying back for the use of the building. Things that we're looking at in the future, continuing with the video productions that we're doing. We're doing snippets right now. They're finishing a 30-minute program, informational program on heroin. We're able to grab Paul Vance, the lieutenant from the state police, other state officials. They're filming tomorrow up at our police department. They interviewed students from the high school, and then we hope it'll be grabbed by someone. We're looking at providing more opportunities for students. This came back in a survey that we did last year, who really aren't interested in going to college. They want something else. In many cases, the parents don't have the, they're not able to take these kids off. And so we're hauling busloads of kids to various technical schools in the area. other types of careers. It's working pretty well. Looking at a couple of different grants, more community service projects, parenting skills, we're going to continue with that, and then social media, trying to stay ahead. Facebook's worked really well for us, but in the next year, it's going to be gone. It's used now by us. Kids don't use it anymore. So it's always trying to find the next thing that's going to work for us. That's it.
Thank you, Beth.
Thank you for the presentation. That was great.
Thank you.
Information. Did you guys get the logo?
We did a new logo, yes. Thank you.
Anyway, for the at-risk programs, I know one of the things that schools and communities are trying to deal with is the health and nutrition of the kids. And I know Mike talked about working with the hospital on some things. Is that something that the youth agency could also be a part of?
Definitely. I know in our latchkey program, a lot of those kids are coming in early in the morning, very early, and have taken advantage of programs that were offered at school. We try to work with the parents to upgrade the lunches specifically that they're bringing with them. But it is something, yeah, that we do.
Like healthy eating,
Yep.
and just right choices. I know Northville's got a new program
Right.
now, so that would be great. And then I remember last year when you talked about the maple sugaring project, you talked about potentially moving away and having Sullivan Farm take it over. Is that in the works, or is this something the youth agency could?
I think we kind of did a 180. It's a very specific type of knowledge that you need to do it. There are very few people left for good reason. And so we decided in conjunction, what we did was we split. We do the operation as far as actually making the syrup, and then Sullivan Farms offers the educational program for school groups, for people that want to come through and just see what it's like. So it took that major portion off of us. It makes it a little bit easier because it is a big job. But we're not really doing a lot right now.
I know, we'll worry about
Yeah, a little.
And then one of the things that you didn't really mention very much, but I know my children partake in, is some of your butter programs. So the ski club and some of the hikes and everything that you do. And again, back to the at-risk children and the health of the community, it'd be great to see a lot more of those types of physical activities.
Yeah, we run this balance between recreation and what we call therapeutic recreation. There are a lot of recreational organizations out there that are providing these type of activities, so we're trying to look at and target this to specific groups sometimes, or just to offer the skiing. There used to be a ski club in the school system, it's gone. We have, I think it's 48 kids signed up. Yeah, I mean, they're running 2 buses every week up there now. And it's great, and it gives the kids an opportunity who, normally wouldn't be able to go with a parent, or, the parents have no interest in skiing. And it gives them an opportunity to go up. They've given us a really good deal. But yeah, there are a lot of things like that. We could be here all night.
Well, you do a great job.
Thank you.
And then the only other thing is, since you're so good at bridges, maybe you want to start working on the Lynn Deming project too.
Lynn Deming, where's that?
Thank you, I appreciate it.
Thank you, Beth. Pete?
Thank you, Mayor. Mark, thank you for all what you do with your staff. I did have a couple of questions.
Sure.
One of the things is the latchkey program.
Yes.
That's increased, you said, to 180 kids?
Yes. Well, it's always been around 160, 180.
Okay. And the increase, is it just because of the economy itself, or?
The economy drives most of it. It fluctuates pretty dramatically. Right now, there are a lot of two-parent families where both parents are working. There are a lot of people who I think are single parents who cannot make it on what the state of Connecticut is providing and have to go to work. And they need a place to drop their kids off. Right now, it runs primarily single parent situations. And again, that, depending on how the economic situation is, it varies dramatically.
Right, without that, they couldn't work, or?
Exactly. We find, a lot of people calling who are basically having to go back to work and are looking for a place to bring their kid. We're unique in that we provide school-age childcare. We don't, get into the younger age groups. We're dealing primarily with the older kids, which is a unique situation in itself. And we've been fairly successful at it for about 30 years now.
And the next question is about the MAX itself. You spoke about the catering and the growth in that. What different organizations, parties, people, just all using the facility itself?
We don't do any advertising, so it's all word of mouth. But we find that, there are 3 or 4 nonprofits that tend to use us now. The fire department, we've done several things for them. The senior center, again, the Rotary comes once a month. The Republican Party supports the MAX. And there are 1 or 2 other groups, but I think they've been happy with what has occurred. I think they like the idea of supporting a program that's run by students, teenagers in the community, and so they come back over and over and over again. We don't do a lot of private work. We've done 1 or 2 weddings, which was brutal. Now I know why catering people look the way they look. It's just incredible. We have some fairly big stuff coming up this spring that again just kind of falls in our lap. We're very lucky in that we have Maggie Calandrio, who ran Food for Thought. We have Bill from Upper Cross, Mike from Holiday. They've all come over and worked with the kids and kind of get together and work with each other on these bigger events. What's really, again, fantastic is that this year, I think we have 6 seniors. 2 of them are going to culinary schools this year, and that's what they want to do, even though they've experienced working at the Met. So it's kind of interesting, and it's been a lot of fun for everyone.
Then obviously, my last question, obviously, besides the income that the young men and women get, what have you noticed as far as life-changing? Could you give us an example, name, kind of a life-changing event?
Well, I think the biggest thing, in fact, we were dealing with this weekend, is the concept of taking responsibility. There comes a point when we like to release them, so to speak. We did this at the farm, we do it at the MAX, where all of a sudden, we're not there. I mean, we are, but we're not right there anymore. And they're responsible now for, the cash register, making sure the food's right, doing all these things that are adult responsibilities. And they now have them. It's very rewarding to sit down and talk to them after they've done this. And talk a little bit about the experience, how it went, and see them make the transition from student at school, where they're goofy and having a great time, to being an adult. And they're 16, 17, 18 years old, but they have adult responsibilities. And some of them accept them very, very well. Some of them have a harder time trying to make that. But the idea that they can take that and then go out into the world and have an idea of, there are times when you have fun, but there are times when you have certain responsibilities. And that's something I don't think a lot of teenagers understand. And I think it's what I like about the program.
Thank you. Thank you, ma'am.
This is fun, huh? This is fun.
Yeah, it is.
Huh?
Thank you, Mayor. It's good to see you, Mark. You run such an elaborate of programs. It's amazing what you do. And I think you touched upon it a little earlier. I just see two things here. The Counselor One I think you touched upon it before, but I didn't hear it.
What basically happened was, we have 2 social workers. They work each 20 hours. This year, one of them decided that she was going to go get a job with the state of Connecticut. And at the same time, the other individual really wanted to stay at the agency. What she's doing is incredibly important. And so we took hours from that one and put it on to the other. So while it's an increase, it's actually just a movement over. The second one, I think, has she comes in and runs a specific program for teenage moms, which is 10 hours every other week. And so we were able to move that between the 2. At some point, we probably will go back to having 2.
So that was the shift in the reduction in counseling.
Exactly, right. So it's not actually an increase,
Right.
it's an increase in hours.
Right.
She does 28 hours now.
And I think you mentioned this in your presentation, but the video lab really wasn't part of the budget last year, but happened this year.
We were able to get a grant from the Harcourt Foundation to get it going, and we will do the same this coming year. Initially, it started with a grant from an organization in Danbury. I forget the name of it. But Harcourt stepped up and refurbished the computers, the equipment, things like that. Provided money for.
That's the video lab.
Right, we have a classroom which is basically dedicated as a studio. We have a big green screen. Works really well. And they're doing a weekly update for us within the context of our websites. Excuse me, this 30-minute documentary on heroin will be our first real big time video that we'll put out. And hopefully that's going to be ready within the next couple of weeks.
Sure. Thank you very much.
Thank you, Tom. Katie?
Great, all the programs you do. And I just want to say that if, just as a comment really, the kids that work at Max do cooking, by all means, you should expand that. That is one of the best programs I've ever, of that type that I've ever seen. I've eaten in a lot of these chef environments, and the lunches are fantastic. Also, your catering is, I know you don't advertise it, but you should. It's fantastic.
And one of the problems I think that we have, we're always cognizant of the fact that, as one of the farmers up in Kent used to refer to us as a bunch of socialists. We're heavily funded by the town, and so when you go out into that play field with other caterers that are trying to make a living,
for the parents of the kids that you serve, for the families that who use your other services. I mean, catering has a connotation of being a highbrow thing, but catering also means I just don't have the resources or the time to make salads and stuff when the family comes, and you are accessible for that, and I think that's very good. I just have one question. What's the number or ratio, whatever, of full-time versus part-time people that you have overall between Max and all your programs? Would you say they're mostly full-time?
No. Probably at any one time we have about 40, 45 people a week that work for us. Of those, there are 9 full-time. The rest are all part-time.
So it's all good. Thanks.
Mary Jane?
Your social worker is a licensed clinical social worker?
The individual we have now, Laura, has her master's in social work, working towards her state license.
Mark, I have a question about the van. What's the advantage of leasing that over purchasing?
For us, because we're paying for it, it allows us to, spread out the $50,000 for the van over 5 years. So instead of coming up with a one-time $50,000 amount, we can do it in increments of $10,000 a year. The alternative would be to come here to you and say, I need $50,000 for a new van. It's better, I think, when we come to you and go, I can raise about $10,000 a year between all the programs putting in the pot, and we'll lease the van. It costs a little bit more, but it's not, putting a burden on the taxpayers.
This is the lease purchase,
Right, yeah, so we will own it at the end of
so
the
at the end, we
process.
own it. Other questions at this time? Thank you very much.
Thank you.
Appreciate it. Okay, next up, discussion of town clerk budget, page 95 and 295.
This is my first time, so. Basically, the big difference is in the personnel. See, it went down. We need to take this out. Not funding the deputy position right now, and put in for an upgrade for the assistant, which brings it up a little bit, and then for seasonal help. So that brings a savings of $39,883 for the personnel.
So the seasonal help will help you during,
During the summer months, for vacations and for, the drug license. We're real busy with that.
it'll help with the counter work.
Right. Yeah, the fishing picks up also, but it's really, the girls are really, and the land records, everything kind of picks up from summertime. So, let's see.
So then you have the contractual services, if you want, oh. You want to touch on that?
No.
Well, the contractual, we have, it's a little more for the ordinances, because we'll be having, have to print the code book again every 2 years, so that went up. Supplies, I put up for 1,000 because it was over 5 or so last year, so just to cover for increases on things. We go through a lot of printer cartridges, printing.
And of course, I adjusted for the alarm system and the architect.
Right, the alarm system, I've decided that we don't really need, we have, locks on doors, most things are in the vault, and there's cameras in the hallway, so there's really not a need for it. And the architect was, I kinda itemized it, thinking it should be on its own line, but it's really included in that same things.
Well, Pete has a question. Yeah?
Thank you, Noreen. Just a quick question, how's the historic dock preservation, how's that going?
It's coming along, we got the check from the state, so we've got 3 different projects that are gonna be happening. I just have to have the total difference so I can put in my PO and have all the money lined up. But everything has to be done by the end of June. We're doing, roller shelving in the vault, we're doing more scanning, microfilming, and we're getting a new update on the Laserfiche for our vital system, and a new, scanner for it, as we scan all the vitals.
Great, thank you. Thank you, Mayor.
Thank
Thank
you.
you, Noreen.
Katie?
Well, Noreen, after your long tenure in your position, I'm gonna put you on the spot. The vault size, we had heard over the years from your predecessor that perhaps, we're running out of space, et cetera. What do you feel that, before we have to think about some other storage area?
Well, I think you can store minutes and things off-site, so it's probably cheaper to do that.
And just keep those that are really have to be.
Right. Well, the ones, you just have to be able to electronically or give them to people. They don't have to be stored there.
No, but the things that do, what do you think?
Oh, yeah, like the land.
A long time before we have to.
Yeah, I think there's, there's different things that can probably be rearranged and
stored somewhere else.
You
like
said
I
you had new shelving.
Yeah, we just ordered new shelving, and, like, there's just lots, not lots, but I went to, an orientation, they said with FOI, the only thing you really have to store is agendas. That as long as you can produce minutes electronically, they don't have to be on your site. So, I think it'll be years myself, so I think it should be okay.
Thank you, Katie. Tom?
Thank you, Mayor. Noreen, so far, I am incredibly impressed with what you've done. You got about a 12.5% decrease in your budget. With reduced staff, I'm very impressed. You've taken the reins here and reduced the budget, and I'm sure the service is going to be as good, if not better, as well. Thank you very much. Thank you.
Thank you, Joe?
I'm going to echo Mr. Esposito. We're very satisfied to see what you've accomplished so far in a short time. We appreciate it.
Any other questions for the town clerk? Wow, good.
Can I just add one note?
Yes, ma'am.
Just listening to all the conversations tonight. I looked today because we've been, we've taken death certificates, and there's been so many from heroin and drug overdose that I did a count today. Since January of 2013 to the present, there's been 14 deaths in the town. And I just figured we needed to,
It's overdose.
yeah. So I just figured I'd share that